The following video is to give you an overview of the topics and content areas that will be taught in the Applied Behavior Analysis Technician coursework. The goal is to give you a generalized overview of the areas you should focus on for the ABAT exam. This video will cover 7 content areas. They are autism core knowledge, legal, ethical, and professional considerations, core principles of ABA, antecedent interventions, skill acquisition programming, behavior reduction interventions, and data collection and analysis. Let's start with autism core knowledge. The Applied Behavior Analysis, ABA, Technician's exam covers autism core knowledge comprehensively, focusing on critical areas such as autism spectrum disorder, ASD, and its common characteristics and deficits. The exam includes understanding autism as a spectrum disorder, emphasizing its core deficits as outlined in the DSM-V, which include challenges in social communication and restricted repetitive behaviors. Additionally, it addresses the identification of red flags used in early diagnosis, such as delayed speech and social interaction issues, as well as the various risk factors associated with ASD, including genetic and environmental influences. This knowledge is essential for ABA technicians to effectively support individuals with autism through evidence-based interventions. The Applied Behavior Analysis Technicians ABAT exam rigorously addresses legal, ethical, and professional considerations, ensuring candidates comprehend the scope and role of their practice. This includes adherence to the Qualified Applied Behavior Analysis (QABA) Code of Ethics, as well as specific policies and procedures that guide professional conduct. Key areas of focus include the limitations of confidentiality and the responsibilities entailed in mandated reporting, ensuring technicians understand when and how to report concerns appropriately. Additionally, the exam covers the Health Insurance Portability and Accountability Act, HIPAA, requiring candidates to define and understand its implications for protecting client privacy and maintaining the security of health information. The Applied Behavior Analysis Technicians ABAT exam thoroughly examines core principles of ABA, ensuring candidates grasp essential concepts such as behaviorism and behavior modification. It delves into classical and operant conditioning, distinguishing between conditioned and unconditioned reinforcement and punishment. A significant focus is placed on the 3-part contingency, antecedents, behaviors, consequences, known as ABC data, which is foundational to behavior analysis. Candidates must also be familiar with key behavioral terminology, including concepts like extinction, extinction burst, spontaneous recovery, deprivation, satiation, stimulus, discriminative stimulus, stimulus control, responses, motivation operations, establishing operations, and setting events. Mastery of these principles and terms is crucial for effectively applying ABA techniques in practice. The Applied Behavior Analysis Technicians ABAT exam covers antecedent interventions in depth, equipping candidates with the knowledge to define and identify positive behavior support systems effectively. The exam addresses the PREMAC principle, behavioral momentum, priming, and forced choice, ensuring technicians can explain and apply these strategies to enhance desired behaviors. Additionally, it emphasizes the identification and benefits of common environmental and visual supports, such as functional communication training, picture exchange communication system, PECS, treatment and education of autistic and communication-related handicapped children, TEACH, social stories, video modeling, and visual schedules. Understanding these tools and their applications is essential for creating supportive environments that promote positive behavior and communication skills in individuals with autism. The Applied Behavior Analysis Technicians ABAT exam thoroughly addresses skill acquisition programming, emphasizing the elements of understanding effective goals and objectives for individualized learning plans. Candidates learn to implement task analysis, which involves breaking down complex tasks into manageable steps to facilitate skill acquisition. The course also covers various topics related to prompts, including types of prompts, least to most prompting hierarchies and prompt fading, and ensuring technicians can identify and use appropriate prompts to support learning while maximizing independence and avoiding prompt dependence. Mastery of these areas is crucial for ABA technicians to develop and execute effective, personalized interventions that enhance the learning and development of individuals with autism. The Applied Behavior Analysis Technicians, ABAT, exam thoroughly explores behavior reduction interventions, focusing on the components and purpose of a behavior intervention plan, BIP. Candidates must identify and describe the 4 functions of behavior: escape, attention, access to tangibles, and sensory stimulation, and understand functional behavior assessment, FBA, as a tool to determine these functions. The exam also covers various contingency interventions, including token economies, positive practice, overcorrection, response cost, and timeout. Additionally, it addresses differential reinforcement procedures, such as differential reinforcement of other behavior, DRO, differential reinforcement of alternative behavior, DRA, differential reinforcement of incompatible behavior, DRI, differential reinforcement of low rates of behavior, DRL, and differential reinforcement of high rates of behavior, DRH, all aimed at effectively reducing challenging behaviors while promoting appropriate alternatives. The Applied Behavior Analysis Technicians, ABAT, exam comprehensively covers data collection and analysis, emphasizing the importance of reliability and validity in behavioral assessments. Candidates must understand the components of operational definitions to ensure clarity and consistency in data collection. The exam addresses various types of assessments, including preference assessments, self-monitoring, antecedent behavior consequence, ABC analyses, and environmental evaluations. Additionally, it covers different types of measurement techniques such as frequency event recording, duration recording, time sampling, interval recording, partial interval recording, and latency recording. Mastery of these concepts is essential for accurately tracking and analyzing behavior to inform effective intervention strategies. This was a quick overview of the main topics and areas that will be taught in the ABAT coursework. What has been presented here will give you a solid idea of what to look for in a good training course for ABAT certification. For more information and study materials, please visit QABAboard.com and TBU for QABA.org.